What are your views on the ACA? Do you think that was a good thing in the beginning, or do you think it's something that's feasible down the line, or something that can still be built on, or do you think that maybe it should just be scrapped and started over with?
So when the Affordable Care Act principles were first made public so that people could sort of weigh in on if it was going to be good or bad, before all that, like you said, there were a lot of different types of insurance that people could buy. So you could buy insurance that was just for the emergency room. You could buy insurance that you thought was covering certain things, but they would carve out a lot of things. And before the ACA, insurance companies could consider pregnancy a pre-existing condition and eliminate you from the health coverage. They could cancel your coverage if you got pregnant. You could be disqualified from having your insurance if you got pregnant. So it was very difficult for people to move forward in life with insurance without knowing if they actually had something that was going to be there for them when they needed it. So the ACA was born out of those fears. Standardize all insurance so that everybody knows what they're getting and nobody gets surprised. And all the insurance companies have to provide these services. So when we talk about preventive care being free, like colonoscopies, mammographies, cancer screenings, they're actually paid for by the monthly premium. So it's not necessarily free, but you don't have to pay anything extra out of pocket when you go to get this service. So if you're paying your premiums every month, then you're going to get these things for your premium. Because before, if you paid a premium, you might feel like you weren't really getting anything for your money. You're paying money to this insurance company, and if you never get sick, you're never getting anything back. And people didn't like that either. So when people say their premiums went up and they weren't happy about it, they may not have been paying attention to these health prevention services that they were getting, an annual physical every year with labs, a mammogram if you were of age, a colonoscopy if you were of age, other cancer screening that's necessary. These are things that are designed to improve your life expectancy. And in my opinion, it was well worth the money that's paid from the premium. But I mean, I can see why people weren't happy with it. But in general, stabilizing the market so that everybody knows exactly what they're getting for their money was very good for the long run.